Welcome. I'm Stephanie, your host for today's Beyond the Treatment Table on behalf of the APTA Private Practice section. The topic in focus is negotiation, and our guest expert is Mitho Hansen, CEO of Hansen and Associates Physical Therapy in California. Hi, Jean. Negotiation is a broad topic, so we're going to narrow it down to negotiating with staff and dive into Mitho's article for Impact Magazine, which covers navigating a staff exit. In the article, there were 3 categories that were defined. So the different stages that you might be in coming to this call. And I'm going to outline those and then put them in the chat so that we have an idea of where you're at. So the newbie is someone who is stepping into a leadership role maybe for the first time. The prepper is considering possibly, or just collecting information so they're ready in the future. And the reflector, you've been there and now you're comparing approaches and you want to reflect on how you handled past situations. Hi, Nisha. Hi, Dawn. Happy to see repeat offenders here. So while I'm putting this in the chat, if anyone else wants to turn their camera on, this is going to be interactive. I'm going to be calling people up to share, come off mute, jump in the discussion. Okay, and just a reminder at the end of the call, there will be a survey that pops up, and that has been super helpful in shaping these sessions. And I'm going to ask 2 people to stay on to give me feedback. So if you haven't stayed on, if you can just hang out for 2 minutes and tell me how things are going. I'm going to put my answer in the chat. So my practice is 2 locations. We have 8 people total. And I'll say I'm both a prepper and reflector. So I like to know, be ahead of things, have the process laid out. And also, I've had situations that I could definitely reflect on and see if there's any better approach. Does anyone want to come off mute and just speak theirs out loud? Okay, another prepper reflector. Kate reflecting. And no problem if anybody's eating lunch and you don't want to be recorded, that's fine. Okay, Nisha reflecting also. Okay, the emotion part. Mitho's definitely going to cover that. We almost went too far in our prep call last week. I had to pump the brakes. Okay, and Kathy also prepper reflector. Anybody want to come off mute and share a little bit more or? Agreed. Always good to learn strategies for these conversations. Okay, well, while the last few people are putting their answers in the chat, do you want to formally introduce yourself?
Sure. My name is Mitho Hansen. I am the CEO of Hansen and Associates Physical Therapy, and we operate in Corona, California as Corona Hills Physical Therapy and Wellness. We have 6 staff, and we're a neuro-based clinic, but we provide orthopedic services as well as cardiopulmonary. So we focus in a specialty space here in Southern California. And our services kind of range throughout because we have expanded our telehealth and our in-home concierge services. So we extend beyond just our office gates, essentially. So that's us.
And something that we talked about a little bit is your experience prior to becoming a clinic owner in some leadership roles where you learned some of these tough conversations and strategies.
Yes. I think where it began was in 2008. If you remember, that was the economic downturn. And my first true managerial position. I was responsible for this entire department, and the downturn affected the hospital's bottom line. And so, the CEO gives me a call, and there was a response to have to come up with essentially a dollar amount of what we were going to save the hospital at that time. And so in doing so, there's, when 60% of probably your expense is probably in labor, that was the only solution essentially. So I had to, in my first, I think I was there, I think I started in July, and then by August maybe, where we had the downturn, um, I have this charge to um, find ways to reduce our labor force. And in doing that, I had to learn really quickly how to carry this out and do it in a manner that's consistent with the rules in California, which if you're not in California, they're incredibly stringent rules on hiring and firing staff. And going forward, having to learn that on the go on the on the run. So, and we talked about emotional preparation. Nothing prepares you for becoming a new administrator and sitting down with people that you're trying to get to know and understand how they work and how they function and what their roles are and understanding who they are and who their families are. And then you get to a place where now knowing full well that someone's husband just lost their job or someone's spouse just got sick, that you may need to hand them a termination notice. So this was my first experience, but it definitely was not going to be my last. And so over the years, I had developed a strategy essentially is start with the beginning first and start with the end in mind first, and then kind of decide how you want to carry out this process. So that's my background in this, and from a unit hospital administrator to a district, a regional director for 13 hospitals in Southern California. It went from just that one unit to 13 facilities where, I had that responsibility should the needs arise. So that's my background in this arena.
Mm. One of the first questions that I always ask is, what resources can you share with the group? And I thought your initial answer last week was interesting because you said this is not something you could read in a book. So talk a little bit about where did you go?
My initial, and again, at the time, I'm in a large organization, so we have access to our human resources department, and obviously that is kind of one of the go-to places. Always tag them in first and get an idea of what the rules are to this. You're going to implement this process. You have to get some feedback in the legalities of of making these decisions and making sure you're doing the right things. Um, but you're right, there is no preparation for it because you can read all the articles now in private practice, and because of the state that I'm in, you have to stay abreast on everything that's happening. So our payroll provider is ADP, and so ADP has a ton of resources on their website to access and look at in terms of rules for hiring, firing, and that sort of thing. So you want to make sure that you have a clear understanding of exactly what you need to do in order to prepare. And then the other resources that are out there are an organization called SHRM. There's called SHRM. It's SHRM. I had to write it down because sometimes I get that one wrong. But it's a human resources organization. That's pretty much all they do is talk about the ins and outs of uh, employee resource management. So tapping into those sources is a tremendous research. There you guys see in the chat there, but definitely a great resource to kind of help um, guide you if you have any questions. And really, it boils down to what state you're in, because what would be in effect in California may not work in in South Florida or in Florida, period. So you have to have an understanding of exactly what the rules and regs are for your state so you can make the right decision when the time comes.
That's great for the following the rules, being prepared, making sure we're staying legally within. What about the emotional aspect? Where did you go? How did you deal with that? Are you going to a family member?
I will say this is one of the things that the very first time I had to terminate or separate someone from an organization. It was the first time, and it wasn't just one person. I had to go through a series of meetings, and I think that first day it was four people, and then the next day it was three, and then I had one more the day after that. And I'll never forget the CEO pulled me into his office afterwards, and I think I was just, it takes an emotional toll, and he was a man of many words, and this was the one that I guess always stuck with me. And he said that it just matter of factly, he just said, they're going to hate you for the rest of your life, right? Um, and I thought, wow, what an encouraging thing to say. But this is a very real process, right? And it goes back to the hiring process and how you choose the person you bring on. But to get support in that moment, this is a very real human thing because you're separating someone from their livelihood and all the things that come with the security of that, and then going to the going to a place where you're they're in a void of what do I do next in some cases. And so um, I think for me, anyways, this is kind of the necessary part of a business cycle. So when you're planning on hiring, I implore you always to know exactly worst case scenario if I have to let this person go. Kind of start there. What do I really have the right person for this? In the state of California, we use the 90-day window where you kind of ramp someone up. Really take that 90-day very seriously because I will tell you after you've done it, if you've done it for the first time, it's not like you've seen a reality show always. It's not, you get to find the person that you absolutely abhor and then it just feels cathartic, right? The reality is that, there are people with families or real life situations that you have to deal with. And the responsibility of that does weigh on you. And it's not an easy thing to do and nothing to be taken lightly or, um, to make jokes about. You can afterwards just to kind of get it off your chest or whatever, however you do to resolve that. But I don't think there's a time where I've ever done it that I've actually felt like, oh, great, I feel so much better now. So yeah, I hope I answered that question because I don't have a good evolved way of dealing with that emotion, I guess. I don't know. I grew up in the 80s. I apologize. Uh, so um, it's kind of just the necessary evil and part of the business cycle. I guess I've rationalized to myself, and that's a necessary in terms of operating a business that may come to pass.
So there's no quick fix breathing meditation technique that you do right before that's going to make this easy.
No, if you've ever broken up with or in a relationship, right? Like a breakup in a relationship is not an easy thing to do. Like, there people write songs about it and they, write movies and plays and things like that, whatever. This is kind of the same thing. This is unless you really absolutely abhor the person. Again, that's one of those things where it's kind of like catharsis. But this is on the other side of it. It really is something that you have to, I mean, if you're human in any way, you will feel that a bit and it will cause you to reflect. So those of you who are reflecting on it, um, remember that experience and know how good or bad it was going into that, and it can make a difference.
Before we get too much into reflecting, what does the actual process look like the day of?
Mm.
So for the
Oh.
people who are in the prepper stage and they want to know how to
Mhm.
outline this, or maybe they're close to it, am I sitting down with the person and having the conversation and then they pack up their things and leave that day? Are we creating a transition? What happens to their patients?
Well, you enter this with a plan. So if you have that 90-day window, well, let's say you're beyond the 90-day window because they were just
Yeah.
perfect, right? They were excellent, and whatever happened, it's a year later. So we take that 90-day window out of the equation. Um, you have to start documenting the moment that you realize that something is wrong. Whatever that something is, that's up to you and your organization. Start documenting and making a paper trail, because when you go through this process now, always ask yourself, and again, this is because, we're in Southern California, we have to think about the litigious nature of our state. You got to be mindful of certain things. You want to start from the beginning, documenting everything that this person is doing. Um, uh, let's say I'm going to come up with a ridiculous scenario, so it's a little lighter, but um, that documentation, it should be, at today at 3 o'clock, went in and I saw um, Steve punch the patient in the arm. It's ridiculous, right? We're going to say that Steve punched the patient in the arm. You had a conversation, so typically the phases go with a verbal warning. Steve, please don't punch our patients in the arm. Again, it's a ridiculous scenario, so just work with me here, right? Um, you go from that conversation, even though it's supposed to be a verbal warning, you have it in writing that on this day at this time, I had a conversation with Steve about please not punching the patients. And the next phase is Steve punches the patient again. Again, I'm hoping you would have fired Steve in the first phase, but whatever. This is kind of like a behavioral trend, right? You're tracking a behavioral trend that this person is doing that is against your rules or your regulations, or whatever the case may be. The second phase is you talk to Steve, you create a plan. Now you're getting to the place where you kind of in your gut that Steve is not the right person for your organization. What you want to do is create a plan. You can do it for a 2-week plan, you could do a 4-week plan, you could do a 90-day plan. Whatever you choose to do, just make sure it's documented. Write your goals down. So, Steve, I'm giving you 4 weeks to comply with not punching patients, and make sure that you have this is hilarious even for me. So you have a plan, 4 weeks time, Steve will no longer punch patients. Otherwise, we will have our final meeting and then go on with that. So Steve goes on the 2 weeks, week two, week one, I'm sorry, week 1.5. Steve's still punching patients. You go into the next phase, which is, you're getting to that 2-week window. So now what you're going to do is you're going to plan out the schedule. Steve usually has 10 patients or whatever the case may be. And however you do your scheduling or whatever, you already have your backup plan in place. Do not let Steve show up on the day when you're just absolutely tired of him and then you just throw him out, because you still have a business to run, right? You're going to plan out how you're going to cover Steve's patients for the day. That doesn't mean that you have to discuss this with other staff members. Doesn't mean you do any of that. If you have somebody or you are going to be the person who's going to take over Steve's schedule, and you can do so quietly without too much hubbub, that's the way to go. The day when Steve shows up and you're ready to do this termination now, you have all your tracking, you've documented both your verbal and your written warning. Steve has signed off on it. By the way, make sure Steve signs off on that plan, that goal set, so that Steve is aware. Steve can never say, I didn't know that I wasn't supposed to punch patients. You get down to the end and you're ready to have this meeting. The best way to do it is to have someone there with you, right? Because you need a visual witness to this event that's about to take place. So whomever that may be, if you're in a small clinic and you don't have very many, like I know your clinic, you have staff They're with you. You can take either your most senior staff, take someone from your front desk, someone who can just be there as a witness. Um, Positioning has a lot to do with it. I don't want to go into too much details because, workplace violence is a huge thing and a huge topic when these things come up. How to position Steve. My brain injury world, we position patients sometimes so that we can evade if we need to. But that last day, you're going to bring Steve into the office. If you can, have someone preparing Steve's things in a box, either before he gets there, the night before, have it all prepared and ready to go. In the state of California, we have to issue their final check the day of separation. So you want to have all your paperwork done, everything is in place, and you're going to sit down in the office with Steve and what you're going to say is going to be very short, sweet, and to the point. This is not the time to argue the points, whether or not he punched hard or he did not punch hard. That's all of that's been litigated already in the behavioral plan that you've established. And you're going to say, Steve, today is your last day. This is your final check. We've not been able to meet the requirements of the behavioral plan that we've established. And today will be your last day. We have your things and we're going to have you walk out. We wish you all the best. And we're going to exit Steve. Now, the person who makes that or has that conversation with Steve is not going to be the person who walks Steve out. The person who's the witness now can take Steve and walk out the door. Steve wants to have his rant and rave. He says he's going to punch you and you're going to do all those sort of things. Do not engage Steve. If you need to, walk out of the room before Steve walks out of the room, but allow Steve to exit. Make sure the person that's with him walks him out. If it's somebody who Steve has a fairly decent relationship with also, that is also most ideal because if Steve is going to get upset, he's not going to get upset with that person. And I'm sorry for anybody on the line whose name is Steve. I just picked a random name. It's been in my mind all week. Sorry, Steve. But at the end of the day, that's essentially what we're trying to do. We're trying to make this process as short as you possibly can. They need to vent, allow them to vent, but don't engage into an argument about what about that time and what about that time. The conversation is over. Here's your check. We wish you the best, and please walk out with Mike. There you go, Mike. Mike's going to walk him out, and that'll be the end of it. Now, the other thing that you want to do is make sure that you watch Steve and Mike walk out. So now you become a witness to anything that happens between Steve and Mike walking out the door and Steve getting into his car or whatever and going on about his way because now you're a witness to Mike and for Mike's safety as well because you never know on that as well. So it's just preparation and my HR director when I did this the first time said don't take a lot of time. Just pull the band-aid off, hand him the check, and what will happen will happen.
So when we're documenting, it's very clear we document and have them sign the behavioral plan, right?
Yes.
What about in the beginning when you're just noticing something and you're documenting your verbal conversations? Is it necessary to have the employees sign? Does this go into their chart? What does that process look like when it's brand new?
I think that's a decision for whoever the manager working with that employee. If you're going to document, if you're at the point where you feel like you have to document every little thing because of this person's behavior or whatever it may be, you're probably at the point where you don't need them to necessarily sign off on every single thing that you note because once you've established the behavioral plan is the behavioral plan. So bringing it back to being a PT, you're basically writing a treatment note at this point, right? And the treatment note is, we had this conversation this day or whatever, still noticing the behaviors are remaining the same. coach, you want to document also your coaching. Um, just because you write a behavioral plan doesn't mean that you've solved the problem. You want to make sure that you're going through and coaching your employee through that process as well, so that, you know, if there's something that's going on with them, that you can find a redeemable process in it. And I'm going to assume that Steve is redeemable always. I'm going to assume that. But if through my best efforts, through my team's best efforts, um, there's not a response, there's not an attention to the demands that we're setting in place, or the expectations rather that we're setting in place, then Steve may not be the right fit for our community, our culture of our team, and may not be appropriate for our patients as well. So we need to continue to document, and then once we get to that phase and Steve comes back 3 months later and says, I'm suing for wrongful termination, you have your notes available to you. So the purpose of these notes are really just, and in Southern California, wrongful termination can come up. If you have your notes, your date, your time, this is what happened. I witnessed this, or we had this conversation again. We had this conversation again. And, you do that for the period of time. And then somebody comes back for whatever reason and says that this was a wrongful termination, you have evidence to suggest otherwise.
Any follow-up questions before I ask mine? Nisha, anything else there? Can I unmute you? Jane, go ahead while she's figuring it out. Or is unmute locked? Okay. Kat, can you help us out here?
Yeah, give me a second. I'm trying to, it shouldn't be locked. Let me,
We have had some rogue people eating lunch without the mute on, so. Okay, there we go. Now I could hear you.
Sorry, two questions, if that's okay. The first one, sort of in that effort to be short and sweet, I've run into the situation where the person wants to have a conversation with me about it, or debate it, or make excuses for the behavior, and I've tried to just sort of be very blunt and say it's not up for discussion or debate at this point, and I've had to I just kind of repeat myself so that I don't engage them in an argument. So that's my first question, is like, how do you kind of just make sure it stays unemotional or non-conversational?
I think at that point, that's why you have that second there, right? So whenever you've said what you've had to say, right? Here's your check. Today will be your last day, and we've ushered in this new reality. Then your second now is going to take over, and it's kind of like hand the microphone over to your second, and then you can leave the room. If they need to say something, allow them to say it, and then once they've finished their piece, instead of responding, and that's why you kind of have to be mindful of how you set that room up. They walk in. Typically, the rule of thumb is chair, table, chair, and then the door is behind your chair, right? The second person is sitting at the end of the table. So if I'm sitting, this is a terrible example. If I'm sitting here, my second might be here, and then that person is sitting here, and the table's between them and the door. Once I've handed over the check, everything's done. We've had our conversation. They want to rehash it. Then I allow them to say their piece, because you also want to make this a respectful process, right? And then I'm going to hand it over to my second, and then I wish you well, and then walk out the door. But if you stay there and keep listening to the rehash, it's not going to allow that to end. And what you don't want to do, because it can become disruptive at that point, is to allow them to kind of escalate in that moment. And there's a lot about timing when you do that. So if you're going to do it at the beginning of the day or the end of the day, based on how your office flows, that will make a difference. My preference is usually at the end of the day, at the beginning of the week. An HR director told me one time it gives them opportunity and hope to realize that they can go on a job search that same day and have the rest of the week to try that process. So it doesn't feel um, as void as, it's a Friday night and I'm unemployed. Instead of going to the whatever, I'm going to be, drowning my sorrows and my despair. And that also, there's a psychological effect as well. And when I look at how um, workplace violence happens, sometimes that plays a part in it. And timing, it has everything to do with it. So be mindful, pick your points, and be very intentional about that flow through process.
And then my second question was really just sort of if you've identified maybe later on that that person was not a cultural fit, do you feel like is that a failure of the interview process? Did you just select wrong? Is it just somebody interviewed well and showed their true colors later, or kind of just what your thoughts were on the interview aspect of it to catch it before?
I can say that I don't know anyone who's, and I'm going to say duped. That sounds terrible, but I've never known anyone who has not had an experience where they've been duped in an interview process. I'm going to say duped. Um, because people always usually people put their best foot forward in an interview, right? Um, so you date the possibility essentially of this person coming in and adding some form of inherent value to your organization. And then when they get in, that's when you kind of see how they'll play well with others in the sandbox. The reality, though, is that it's happened enough times that I've gone with traditional interviews where I actually have patient interventions. I have them work with patients. I have patients that I have that volunteer to actually work with potential employees. Um, and in the past, I've had group interviews with other people from other areas, people that, I consult with even to come in and sit on a panel and interview with someone. And that would be a phase one, and a phase two would be a patient interaction conversation. How do they interact with a patient? And if I know the patient well enough, the patient is going to give me feedback on, based on our culture, how this person actually did in that treatment session. And then we look at their thought process and how they think about the way they interact with patients. So, I mean, even in doing all of that, I've still had people who I've hired that did not fit with what we thought they would be. So, I mean, I don't know a better process. I know people use like personality surveys and they do stuff like that. And I've never done that before because, again, I'm sorry, I grew up in the 80s. I'm trying to enlighten myself. But at the same time, I'm also trying to figure out like, and I still see people doing the surveys and still getting matches or hires that don't match their culture. So I don't know. I don't think there's a perfect answer, but you will have to reflect on that. Like, what works best for my organization, and how do I get the best employee who will match what we're doing? And my tendency is I hire students. We have a ton of students that pass through. My tendency is always to hire someone who's been there, and we know how they work. We know how they've interacted. They understand our culture, the way we operate. And so it's a little bit easier that way. But sometimes that's not always available, or you don't, have access to the best students or whatever. You just have to take the chance. And I don't think there's an easy way to do it. And if someone knows a great way to do it, I'd be open to listening, because I couldn't imagine a better way to do it.
I'm going to take you out of the very obvious situation of our therapist is beating up her patients. And what happens when we have someone who's a little bit more borderline? So let's say we pass the 3-month mark and they're very
Mhm.
close, they're progressing, their caseload's getting there, but there's a couple things that maybe are still needing development. Now we're at 6 months, now we're at 9 months. Where do we go? And when is it us as the person coaching and training them? And when is it, no, this person's not working out in this model?
I think that boils down to, again, what does your training process look like, right? My very own experience had a lot to do with, I started working in a hospital. What's that?
I was hoping you were going to share this
You
story.
were hoping I would share that story. So, my own personal experience was, I graduated from PT school. I moved, you know, across the country to work at Rancho Los Amigos, and I'm sitting there, and everybody who pretty much wrote my textbook is like walking down the halls, and I became kind of, fanned out a little bit and super nerded, and it was just like, oh, I don't want anybody to see what I'm doing. So I basically hid for 90 days, and I didn't want anybody to see me making mistakes, but you become obvious at that point. And so I bring all that up to say, would I have fired me? Absolutely. The reality, though, is are we training that employee or mentoring them or guiding them in a way that gets them to a place where they can be successful? And because of my own experience, I think I err on the side of I I spend a lot of time in developing staff because it's expensive to hire on board, do all that stuff, get them in, you get them going. The patients, some like them, some don't, and you're at this point where you're like, now I got to let this one go. But you really have to ask yourself the question, have I prepared this person to be successful? And am I the right person to explain it to them also, which is another point. Sometimes it's not you. Sometimes it's they'll listen to person X, whoever that is. It could be an aide or whatever that speaks to them and says, "Hey, you gotta pick up on this or that." And if it is you all the time, sometimes that has and I apologize for anybody who's young in the room, but sometimes there's a generational effect on that as well. And I realize that. And now I realize I'm the old guy in the room. I'm not the young guy anymore. I found that out. But what happens is that sometimes younger staff, you pick your best youngest staff or someone who can relate to them a little bit better to guide them through that process. Now, let's assume that you did all of that. You've done all the right steps. You've trained them. You've taken the time. You've developed them, and you get to that point where it's just not clicking. Then that becomes now your responsibility to decide, this person actually not working out for us, and you have to make a decision at that point. My tendency is to try and make sure that we've gone through every reasonable resource to help develop this staff member. And if we haven't, then I'll take responsibility for that. That'll fall on me. And then beyond that, then I'll go into we need to do something different.
Jane?
Hi, everybody. I think you make a good point with new graduates that so you got a job at Rancho, like not everybody gets that.
Mm-hmm.
Yeah, that's excellent. And you know, as a leader, recognizing what imposter syndrome looks like or imposter phenomena and having your strategies to deal with that. I can't remember what year, but when we were doing colors in the red one, I wrote an article about how to red light imposter syndrome. And I interviewed a few people, and there is a gal who was Lauren Bilski, who was I interviewed, and she was recognized by APTA as an emerging leader, and still she got to McGee Rehab, which is sort of like the rancho of one of the ranchos of the East. It's really, and when she told me she had such imposter syndrome, I was like, come on, and so I think your reaction is not unfounded. It's just a matter of leaders understanding that that's what they might be encountering and what are they going to do about it, because the behavior may not really be what the person's about, and they need to make sure that they're not going to actually lose a really good employee. So just a point to bring.
Yeah, no, totally. I totally agree with that. We didn't have words for it when I was growing up. So,
Yeah, my class
yeah.
we talk about imposter syndrome because
And it's a very real thing.
because everybody has it. I'll stand
Mhm.
up at CSM. I'm doing a talk. Somebody thinks I know enough to do it, and I'll stand up there
Mhm.
and go, "Oh my God, why do I do this to myself? Why do I
Right.
why do I submit to present? Like I
Mhm.
don't know enough to be here in front of all these people." And I'm like, 40 years into this profession. And so,
Mhm.
and maybe it's something newer that I just got interested in, and I'm not an expert, but I put a lot of effort into learning about it and think
Mhm.
it's important to share. And then I'm like, who am I to do that? So we all have it it happens all the time. And I think
Oh,
that's
absolutely.
a great way to approach maybe younger, newer therapists or therapists that are maybe transitioning into a new area of practice. So they've been practicing for a long time. Now they go to be vestibular or pelvic health. We're
Mhm.
working with people that are really accomplished. So just kind of keeping that in mind. We all have it. Being authentic, being vulnerable, we all have it.
Oh, absolutely.
Any tips on how to identify it or how to bring someone out of it and bring up their confidence?
Well, I would refer you to my article, but
I have Impact open. I'll pull it up.
it's all in there. But well, some of the things like you said, withdrawal can be avoidance, not setting goals, because you don't set goals because you think you'll never achieve them. Um, and then you don't want to not achieve them and look like a failure. I'm doing this all from memory. What are some of the other sometimes, well, I said sort of like you did, withdrawal, like not joining the group. Um, and then I think some of the strategies when you're the leader or the manager or director, whatever, is just, knowing what that looks like so that you can A, recognize it, and then B, maybe have that conversation, be vulnerable, maybe give some examples of, when it happened to you and that it's common,
But
and
I think it's,
achievers,
I think, yeah, I think it's one of these things where I think organizations also need to be mindful of their process, right? Like any student, we take a lot of students in our clinic, and any student that comes in our clinic, it's the environment is to bring everybody in so that they are there's no place to hide essentially. Granted, the square footage is small. If you could hide in that place, that'd be amazing. But um, at the end of the day, um, even with new employees, you have to be able to bring everybody into the fold. And I think where I had my change was in mentorship. I got my first mentor, and she sat with me and she said, dude, you suck. And I was like, oh, okay. But she walked me through that process. And I guess even for me, to accept the fact that I think you could say stuck back then, so I apologize. But we walked through that process, and she showed me how to think through, or not think through, but just work through some of the things that I was kind of going through. And, and then I got to a place where I felt comfortable and being able to, you know, play with the other kids in the sandbox because I didn't feel so like different or not able to kind of keep up. And so whenever I have a new employee or a new student or whatever, that's always been my motto is to go hunt them down, go bring them into the fold, um, force them into the process, and ensure that they're connecting with the expectations and the culture of our organization in order to become successful. And it'll weed out also some of the ones that are not able to perform up to the level or standard as well. So I think early and often, check in, ask questions, see where they are, how they're feeling, look at their caseload, review their caseload with them, ask them where they have the questions, and not allow them to kind of, yeah, they're licensed and they have all the stuff, and yes, they have all the pieces of the puzzle and they're amazing. But at the same time, you still need to validate that, right? You still need to validate that this person is comfortable in the things that they're doing and then also comfortable enough to make mistakes. Because I think that is a huge part of getting to that place where you're mentoring someone is to get them to a place where they feel comfortable saying, yeah, I think I screwed up on that one. And feeling comfortable seeking advice or going to someone who, you know, you're being encouraged to go and speak to. Like the people who I was encouraged to go speak to, they wrote the books on, or they spoke at CSM that year, or whatever the case may have been. I don't remember. And you just go up to them and say, well, I have a question about this Easton thing, and you to get comfortable with that. Builds a better, stronger employee. And I don't think every employee fails because they're not capable. I think sometimes it's just because they're not aware of what their limitations can be. And I think if you take the limitations off, what they can do, they may show to be amazing in their own way. So whatever that may be. Okay, I think I'm rambling now.
Yeah, I love this conversation. Um, Tanya, did you have anything that you wanted to come up and ask? No? Just checking in. No pressure. Does anyone else have a specific question? No, I'm sorry, I think I froze for a second. One of the things that I wanted to ask about reflectors. So when you're reflecting on the situation, is there any situation that you want to share of your personal experience that you would handle it differently in the future, or
Well, that's a good question. Um, I think you always go back and ask what could you have done different, and it, it always starts at the beginning. Like, did we have the right employee in the right situation? Um, did we wait too long? Um, uh, should we have uh, done more mentorship, or did we have the right person mentoring this employee? And I, if reflecting back on um, some of some of the people who have had to let go, um, I think that's the one thing because it is a personal thing for me, right? I don't take this lightly again. Um, so when I go back, I always ask, could I have mentored this person better, or could I have done something better to help avoid this situation? And I think that's the point of reflection. Outside of selecting the right person, it really is just a question of um, what could I have done more of in order to get that person to a place where they didn't hit this failure. Because even my own situation, I don't know what came over me, but I basically told my supervisor that my failure was their failure. And if you saw me failing for 90 days, why didn't you tell me something sooner? Um, at that point, I mean, I had nothing to lose, so I just asked the question. And my manager at the time, she she told me that she felt embarrassed that that I asked her that question, and she did everything in her power to get me a mentor who actually got me through that process. And I, I kind of I owe a lot to both my mentor and to my manager at the time because they really could have just kicked me out. I mean, what a jerk! What kind of idiot says something stupid like that? But the reality is that I guess they felt I was redeemable. But again, it boils down to if she would have let me go, you know, no sweat off her back. It was terrible. But at the same time, mentoring me at that moment, I guess it worked out better, I guess. They still say hi to me when I see them, so I know. But so I guess it boils down to, for me anyways, I always say what more could I have done to help prevent that from happening? So I guess that's my only reflection is the prevention phase, not so much the end phase. And the end phases, I would say, um, have there been people that I let go of that I regretted letting go of? And that answer is no, because I stick to my process, right? If that is what needs to happen, that needs to happen, and there's a clear reason why it's happening, and therefore I don't um, have any regrets in that sense. But I do have a remorse in the sense that the human side of me also feels the responsibility of separating someone from their security.
I feel that, and I think that is probably the harder part is afterwards, being left with what did I do wrong? And if you can't figure out what you did wrong, how do I prevent it next time? If I haven't figured out which spot I went off track with mentoring, what did I not support this person with? And I think those are the things that cycle for me.
Yeah, and we talk about new grads, and I'm talking a lot about new grads actually right now. But I mean that even goes. It's the same with anyone who's has work experience, right? Just because someone has years of experience doesn't mean they have the right years of experience and match well in the culture that you have. So mentorship is not just exclusive to new grads, and people with experience still need mentorship, and I've seen that um, through the years as well. So I never take that for granted either. I just wanted to make that point.
Any last questions? Any last thoughts?
I do have one. Um, I had a situation where I had kind of the opposite effect in that I did a lot of mentorship, I did a lot of training, had a relatively new grad, was probably one of the best employees I ever had, and then found out he had opened an outpatient practice behind my back. So I let him go, obviously, the second I found out about that, just because of the risk with everything.
Mhm.
Um, but that put in me almost this, I want to step back a little bit on how much I'm doing because I don't want to face that again. But I mean, I'm just curious what thoughts you might have on that.
Um, that is kind of that's the human part of this, right? That's that act of betrayal, though. That's the, and I don't mean to put it out that so um, so robust, but again, that crosses kind of a boundary of respect and it kind of leaves you with no choice in that sense. But again, this is an emotional process, right? You pour everything into what you do, and then someone goes and does something like that. It will make you a bit hesitant to know what to do next or how to balance that out. And again, that is part of um, that emotional process that goes with this realization that I had the wrong person. Um, and that part, I'm aghast because I mean, I guess I've seen that before in other in other situations, and it's kind of like break and forget because you have to keep moving on. Because that was that person's choice to do what they did, and no matter what you gave them, how you mentored them, how you developed them, that was a choice that they made. And I always tell students and I always tell staff or whoever I meet, this world is a very small space. And we all, especially in the PT world, we all run across each other 1,000 times. Like I could have passed all of you at any one of the meetings that have happened over the years. And at any point in time, um, your reputation stands on its own, and people know about the things that you do. And I talk to some of the other practice owners in around town, and whenever they have their little scuffles with each other, I just sit there and listen. But your reputation and your name is kind of tied into the things you do and things like that. You know, it you know it goes a long way. And so those things I don't worry about because it'll take care of itself in time. But I can't take that on, right? I can't make that a part of what I do every day. And at the end of the day, you go forward. And I, again, I grew up at a time where it's just kind of like, just keep going, forget about it. You still feel it. It doesn't take that away from you. And it's still a very real emotion, especially betrayal. But, you wish them well and keep going. Because at the end of the day, you can't pull yourself down into that moment of, I can't believe this person did this to me. And it'll be a story down the future, but if it doesn't affect you, you just got to keep going. And I'm sorry that happened to you because I'm feeling that one. I'm feeling that one.
Yeah, I think that something like that, you have to take the high road also. I've talked to some owners who get into this, well, we have a contract and the distance that they can open in, and then it just detracts from what you're trying to do. And
Yeah, yeah.
I was just gonna say, yeah, go ahead.
No, 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 I'm sorry. Go ahead, go ahead.
I was just going to say, I started asking those questions on the interview process. And if someone is interested in private practice and they're interested in opening, going out on their own, even if they say, oh, 5 years down the road, then I kind of point them in the direction of, hey, I've got resources for that. I'd love to, mentor you. And I try to ask a lot of questions about risk tolerance.
Mhm.
Like, are you comfortable becoming a clinic director and you want to open your own thing, but you don't want to have the risk of the overhead and all of that? And that's a different conversation. And trying to tease those interests out early on, not that
Right.
that prevents it, but
No,
it has come into my interview process.
yeah, I don't think I've ever asked that question, and now I thank you, Tanya, for sharing because I mean I guess I should be asking that question more often than not, but um I I guess I'm a bit more laissez-faire in that sense because I kind of say to each his own. If someone's going to go behind my back though and try and undermine me, then that becomes a whole nother conversation. Um, but I do wish anybody well who does it. But at the same time, these things have a way of kind of coming back around to haunt people that do stuff like that. So say enjoy, have at it.
Okay. Well, the article that this conversation was based on with all of these steps outlined is in the chat, and Jane's imposter syndrome article is also in there. So for the PPS members, you can access those articles. And next month, our topic is innovation and technology. I already talked to our guest expert, Drew Contreras, last week, and he is going to talk about AI in healthcare. When I asked him some of the questions that I thought the topic might go into, like how is this going to affect our documentation? How is this going to affect clinicians, our staffing? He said, we're not talking about those things. That's small-minded. We've got to come broader. So I'm very excited about all the things that he's going to bring in because he basically told me that we are going to break the system here and think about how this is going to impact our everyday, not just make small solutions a little bit easier. So that's on September 25th. And then we have Chris Albanese on the October session, October 23rd. No call for November because of Thanksgiving. And our last call of the year is member appreciation on December 4th. So we're going to do a guest panel for that. And if anyone wants to hang out and give me some feedback, 2 minutes of your time just to tell me how the session was, I would really appreciate if you hung out. Thank you, Matthew.
Thank you. I appreciate it. Thanks for having me.